does want to accommodate you, and the state is telling your employer to stop accommodating, then Title VII preempts that. Title VII preempts your state or local government from taking away your accommodation. So an example of where this comes up, there's recently in Illinois, Governor Blagojevich, and I always like to tie his name to this regulation. The Blagojevich rule, as I like to call it, required every pharmacy in the state to dispense Plan B without delay, was the term. And so you had situations then where individual pharmacies or chains of pharmacies had a long practice of accommodating their employees. Albertsons was one. Had decided that it was best for Albertsons, in order to attract good pharmacists on staff, to accommodate their beliefs. And so they had pharmacists there who did not dispense Plan B. Some, I'm sure, who didn't dispense contraception at all. And so the Albertsons had a system you went through. You told the correct people, and they put into place a system to work around so that you would be able to do that. Well, the state of Illinois was telling Albertsons to stop doing that. That this, if a woman comes in and she needs her Plan B, and she's required to sit there for 10 minutes while someone else comes and does it, and that, this is too much of a burden to put on women. Title VII, I think, preempts the state of Illinois from doing that. And this argument has been made, and it seems to be actually holding ground so far in Illinois, in case it's still proceeding there. I'm not involved in that one, but I did, in fact, represent the first pharmacist to challenge Governor Blagojevich's rule until Albertsons decided they were actually essentially going to take our side and stand up on it and provided another accommodation for them. The church amendments. Going all the way back to the beginning of when Roe versus Wade was decided, a series of amendments was passed to specifically address this question. Okay, so if we're going to have legalized abortion in America, what does that mean if you have a constitutional right to an abortion, and yet people are, the federal government and state and local governments are giving money to hospitals, including Catholic hospitals, faith-based hospitals. Are they going to be required to assist in abortions because somehow they are connected to the state? That was the argument, which, again, to go back to your 7 steps, that argument was happening almost instantaneously with Roe versus Wade. There was a push to try to force Catholic hospitals in Montana to do sterilizations and abortions. Montana and Idaho, particularly. So Senator Church from Idaho pushed through 387B. Receipt of funds from HHS does not authorize a court or agency to require individuals to perform or assist in sterilizations or abortions in violation of conscience. It also does not require a grantee to make facilities available for abortion or sterilization, or make employees available to do them. So essentially, it robbed courts of their authority to say, look, St. Vincent's Hospital, you're getting money from the federal government, you're violating this woman's, therefore you have legal obligations to actually perform abortions or make people available to do them off-site or something. And so it robbed courts of the authority to decide that. 387C, grantees under a program administered by HHS can't discriminate in employment promotion or termination of employment because of performance of abortion or refusal to perform. Now, this is interesting. It's a topic for another time. But 387C actually does say that if, by its terms anyway, it seems to imply that if a Catholic hospital said, look, this is a noted abortionist in the area, we don't want to give staff privileges to this person because that would scandalize us. The statute seems to imply that yes, if you receive any sort of federal money, which would include Medicare, Medicaid, that's why these are phrased in terms of receiving federal money. For all practical purposes, they cover everybody. So anyway, there's a trick there, and we have been looking at sort of what to do about that problem if it becomes one for a hospital. Notice also that 387C, particularly the second part of 387C, goes beyond the abortion sterilization language and expands it more broadly. That's important, of course, because that's this is your only hook in a place like Montana, for instance, on the physician-assisted suicide, to say, look, if we meet the other criteria, this is about, this hospital is receiving research funding, so therefore you can't force me to do anything in violation of conscience. That's sort of one of your only protections. The other is 300A7D. This is often thought of as the catch-all provision in the church amendments. Essentially, it's just nobody can be required to do anything under a program administered by HHS in violation of conscience. So this is your broadest protection, but it's limited to an HHS program. Most people don't read this language to say, look, if your hospital is receiving money, then anything the hospital does can't require you to violate conscience. It's more like if your hospital is receiving money for a specific type of program, then they can't require you while doing those programs to violate conscience. And then 300A7E, which is essentially a protection for people in medical schools and healthcare training areas. But again, protects particularly in the abortion sterilization context. The Code Snow Amendment, as I call it, people will typically refer to it as 238N of the Public Health Services Act. But this is another protection that came in 1996, and I'll note, we're talking with these laws here. The church amendments were passed and signed by Presidents Nixon, Ford, and Carter. The Code Snow Amendment was signed into law by President Clinton, and then the Weldon Amendment by President Bush. These are bipartisan laws. People from all sides of the political spectrum came together and decided that there was no reason why we should be forcing medical professionals to violate their conscience. So this is not a right-left debate. At least historically it has not been. This has been something that we have had some unity on in this country. And yet now we are seeing a pushback against conscience rights. But it's important to note that when you're seeing that this is not suddenly it's not as if the Bush administration created conscience rights. And it's this radical right-wing idea that sort of came out of nowhere. This is something that presidents across the spectrum have endorsed. Code Snow Amendment, again, the first part is speaking particularly to medical training facilities and prohibits discrimination in that context. But it also, the text of it prohibits discrimination against people who provide or refuse to provide or refer for abortions as well. And then the Weldon Amendment, none of the funds made available under this act, labor, HHS, education, which again, this covers everyone, at least particularly when you're talking about state and local governments. If you happen to be a state or local government that wants any money from the departments of labor, health, or education, that covers everyone. Then you can't discriminate against people who refuse to perform or assist in abortions, or against those who refuse to provide coverage for abortions. So it's certainly an important protection. Those are sort of your laws that are in place. The conscience regulations that have been the recent source of controversy, essentially all they do is say, look, HHS grantees, if you're getting money from the Department of Health and Human Services, you have to certify that you comply with all those laws I just talked about. That's it. When you hear the media reports on this, it's as if they're imposing brand new obligations on people. All they're doing is saying you have to follow the laws that are already on the books. And you sign a certificate saying that you will do that. As we mentioned earlier, I'm presently representing the Catholic Medical Association, Christian Medical Association, and APLOG in lawsuits that are ongoing right now in Connecticut, 3 separate lawsuits that have been filed by 7 states, Planned Parenthood, and NIFRA, all challenging these conscience regulations. And the administration, in the midst of those lawsuits, has decided that they would move to rescind the regulations. This is a good time for prayer, first of all. I think that's probably the first line of defense here. God has worked some bigger miracles before. So, I don't think that's